Today we are going to learn about the complications of myocardial infarction. So just knowing about the basic structure of the heart, it's very easy to study the complications because the complications can be structural or related to the rhythm, electrical problems. That means when there is a problem in the rhythm, normal rhythm, it is called arrhythmia. So regarding the structure, this is the pericardial covering. So regarding this pericardial covering, you can have pericarditis, that is called Dressler syndrome. So first of all, what is Dressler syndrome? It is autoimmune pericarditis. And how it is presented by the patient with a diffuse chest pain. This chest pain, so because of this pericardium can also in relation to the irritation to phrenic nerve, the pain can radiate to left shoulder. So diffuse chest pain radiating to left shoulder. And that is pain is the symptom. So regarding pain, the onset will be gradually pain is occurring. And what about the character? Diffuse chest pain, the site is diffuse, radiation is there, and it is progression. It is lasting not just for few minutes, few hours, it can be there for days. And what is the aggravating factor? No particular aggravating factor. And the relieving factor, it is relieved in sitting position. So doctor can have an inspection, palpation, percussion and auscultation. On auscultation, they can get pericardial rub. Next step, doctor will write for two things, ECG and tropi markers, troponin. So ECG, in an MI you are getting convex, but here it is the QRS is like concave. Okay, so in MI it is convex, which is called tombstone or Pardee sign, but here you are getting concave. Okay, then tropi markers can be normal or it can be elevated, and at last the doctor will give treatment, that is aspirin. Steroids are not given because it is a patient is already had an MI recently, and it is in the stage of healing process. So if you are giving steroids, there will be poor wound healing, and that's why the scar rupture also can occur. That's why. Now other than that, you look at this picture itself. So here, suppose you imagine the thrombus was like this here. This is within the muscles, which is called transmural MI. So this, in such cases, there can occur a problem like it can rupture. So if it rupture, what happens? The blood will be collected outside. Okay, blood will be collected within the sac, that is cardiac tamponade. So that is another complication, that is cardiac rupture can occur, and it can lead into cardiac tamponade. So in a case of cardiac tamponade, you get a low voltage ECG, and there you learn electrical alternance. Next, another thing is, see, because of that, in such cases, the heart may be failing. In the case of failing, such that there can occur cardiogenic shock. Why cardiogenic shock? Heart is failing. It can occur also because of cardiac tamponade, that heart is not pumping sufficiently. So we have to increase the perfusion, coronary perfusion. So the treatment what you give here, you have to improve the coronary perfusion. Coronary perfusion, increase the perfusion. Perfusion occurs in which stage? Diastolic blood pressure, in the diastole phase. So we have to increase the diastolic blood pressure. That means what you actually give is norepinephrine. Another complication that can occur is in the septum. There can occur ventricular septal defect. Another complication that can occur here is regarding this valve, that is the mitral valve. So you have the papillary muscles, the papillary cusp like this, and from where you have the chordae tendineae, and then you have the valve leaflets. So papillary muscles can have ischemia, damage because of MI, especially anterior and posterior. So posterior is having single blood supply from right coronary artery. So in case of this inferior wall MI and all, what happens is the valve can get damaged and it can lead into mitral regurgitation. So this is the most common valvular damage associated with MI. Another complication that can occur is there can be an LV aneurysm. So here in the in the left ventricle, this we have told about transmural MI that can go for cardiac rupture. But here we are saying about the wall can be so thin such that an aneurysm can occur. Okay. So if you have an aneurysm, that is a condition where you get a seesaw apex beat in LV aneurysm. So again the problem remains same, contraction. Left ventricle is mainly for contraction, so contraction power decreases. So the systolic blood pressure decreases, and the blood is not properly pumped, so there is stasis, so it can form a clot, it can dislodge, emboli can occur like that. So in such case you have to give warfarin and heparin. Another thing is arrhythmia. Rhythm can be abnormal. So in the rhythm, here this is the conduction mechanism, so problem can occur in that. Tachycardia, ventricular fibrillation can occur, so that's the tachycardia. At the same time bradycardia can occur, like Mobitz 2 heart block can also occur. So because of this ventricular fibrillation and all leads to sudden death. So that is a case where you have to give DC shock. Ventricular tachycardia can also occur. That means there is an ectopic foci developing in ventricle. So that will exhibit intermyocyte conduction. So because of intermyocyte conduction, you get a broad QRS, and there will be AV dissociation. Atria and ventricle is pumping at different rate, is contracting at different rate. Ventricle is having an ectopic focus. So irrespective that atria is not contracting, ventricle is simply contracting, blood is not getting filled. So though ventricle is contracting, blood is not getting pumped. It is pulseless VT. Here you have to give cardioversion. And on the, so that is VT, ventricular tachycardia, VF, ventricular fibrillation, or you can get Mobitz 2 heart block. So in the case of S-wave, you can get a Josephson sign. It's a shelf-like sign. Okay, Josephson sign. So there is something called a pulseless VT. Here, now you understood that the complications can be like Dressler's syndrome, and next is cardiac rupture, cardiogenic shock, valvular lesions, mitral regurgitation, LV aneurysm, and arrhythmia. Thank you.